Today we have Jodi Lickteig with us, who's going to tell us about being several technology degrees she has working in a medical facility. Welcome, Jodi. Tell us what it is you do and what degrees you have.
I am a nuclear medicine technologist. I also am a CT tech and an X-ray tech.
So define for us what a nuclear medical technologist is, because I personally don't know what that is, and I'm guessing an average 16, 17-year-old doesn't know either.
Yeah, it's kind of a big, scary term, but it is a branch in radiology that looks at the function of your anatomy. So there's definitely different areas in radiology that you can go to. This looks more at how well your anatomy is functioning.
So if I were to come in for a physical, would I normally see you, or what would be the straw that would get me to see you?
Yes, no, you wouldn't normally see me. It would be more of a diagnostic procedure that your physician would order if you were having some sort of anatomy that wasn't functioning properly.
And how long have you been doing this job?
I have been doing this job for almost 9 years. So coming up on almost a decade. So yeah, that's kind of a long time.
Wow.
Yeah.
And you mentioned 2 other degrees. How do they compare to the job that you're doing, or how do they complement the job that you just described?
Sure. So in radiology, there's different areas that we call modalities that help diagnose and treat the patient. So there's CT, MRI, nuclear medicine, ultrasound also falls in that category. Radiation therapy falls in there. And so nuclear medicine uses a radioactive substance and other medications that I would inject into the patient, and then I would take images of them. And then at the end of the imaging, you get data provided to the radiologist and the physician, and it helps with their treatment plan. Now with CT, that is more of an anatomy modality where it looks at, if you have any broken bones, or it's a very detailed modality of your specific bony anatomy. And X-ray is just the 2-dimensional view of the patient.
So you talked about injection. I guess, could you describe on an average day, if you're doing that nuclear medical part, what that would look like from you getting the patient till you reach the diagnostic?
Sure. So there is a lot of back work involved before you get the patient. So depending on what kind of organization you work for, you could get a job in the lab, the radiopharmaceutical lab, which they prepare all the radiopharmaceuticals that's used in the imaging. Where I work, I get all of the doses pre-syringed packaged to me. So there isn't the lab aspect of the job. And so when I get the patient, I do the prep with the patient, and then I explain the exam to them. I give them, I start an IV typically, and give them an injection of this tracer that localizes to the area that we're looking at, whether it would be the heart or the gallbladder or the thyroid. And then depending on the exam, we image them anywhere from right immediately after we do the injection, or they leave and come back a few hours later. Sometimes they take a pill and then they come back a day later. Now, there is an exam where we're looking at their lungs, and they'll inhale a radioactive substance, and then I will image their lungs. There is an exam where they eat radioactive eggs that we would prepare, and that's called a gastric emptying. And so we see over the course of 4 hours how fast or slow their digestive system is, and how that compares to X-ray or CT is with CT, an X-ray, the patient is the source of the image. So you lay on a table, you go in a machine, or a machine comes over you and it takes pictures, and then the exam is done. With Nuke Med, the patient is the source of the picture. So they lay on our table and then the picture comes from them. Does that make sense? I know it's kind of a lot of information.
No, that's very good. I appreciate just defining between the two because it is a field I'm not very familiar with at all. So what degree do you have that allowed you to be able to do what you're doing, plus the radiology degree
Sure.
X-ray piece? Because I know that can be broken off and people just do that job. So how are you able to do it all?
Yeah, so I have a 4-year bachelor's degree in radiation science, and there's definitely different ways that you can go about working in this field. So you can get a 4-year degree in any sort of healthcare field, like biology. Some people have a nursing degree and then they branched off, and then do the 12-month dedicated nuclear medicine specialty. For X-ray, it's a 2-year degree some places, and CT is extra board testing. So once you went to the 2-year X-ray school, you would study for CT and then would take a board exam. And that's typically, you can do that on the job. And it's usually about 6 months to an extra 1.5 years of training on top of that.
And what would you say somebody starting in this field would make for a beginner's pay? Not been in 10 years as yourself, but just a beginner.
Yeah. So I know that X-ray, they can start anywhere from $25 an hour up to $35 an hour. And depending on what additional specialties that you have. Nuke Med ranges anywhere from $35 an hour to $55 an hour, and that all depends on years of experience and location of where you work. So you can work in a hospital setting or a clinic setting, and you can take call, or you can take weekends or holiday, and all that depends on your wage as well. That the more you take call, the more money you would make. If you work in a dedicated private clinic that would just do specific like heart testing, those can make a little bit more money too.
Yeah. So what is it about this job that keeps you doing it and coming back day after day and staying in the field for 10 years? What do you like about it?
Yeah, I love my job. I always knew that I was going to work in healthcare somewhere. And I like the fact that every day is different. The part that I like about my job, especially the Nuke Med part, is the lab part of it, and like the behind the scenes. And then of course it's just like icing on top of the patient care aspect, because you're truly making a difference and helping someone. So that is what like gets me to work every day, is the helping of people. Yeah.
What would you say would be the technical skills of the job? I know we obviously need a degree, but what would you say on the job would be technical skills you would need to be able to do such a job? You mentioned like the needle, so I'm guessing you've had some phlebotomy training.
Yes. Mm-hmm. And so the technical skills would be your IV starting, your ability to run a imaging equipment, a strong desire of math and science. That's a big, and physics. That's a big part of the schooling part. We use different sorts of machines, like the imaging equipment. We use dose calibrators that measure the radioactivity in the doses. We use this machine called a Geiger counter that detects radioactivity. and then a strong background in computer science. A lot of everything's computer based, and then of course, just the patient care aspect, just being able to relate to patients, kind of know what they're going through. That would be not necessarily a technical skill, but that's definitely a big part of the job.
Yeah. What about teamwork? Do you work alone or are you with a team for the patient care? How does that work?
Yeah. So both. So when you're with the patient, it's definitely one-on-one, but there's different departments that you coordinate the care with the patients. You work alongside the radiologist, you other nursing staff. I have coworkers that are other techs that you work pretty closely with. So working independently is something that, with little direction, that you have to, you have the best of both worlds. You can work, you're working by yourself alone with the patient in the room, but there's also procedures where you'll be working right alongside the doctors and other physicians.
Okay. If you are going to give advice to a kid watching this, maybe is undecided if they want to do this job or another healthcare role, what advice would you give them as they're starting to think about their career path?
Yeah, that's a great question, because I feel when I was in high school, we had a class that was dedicated to after high school, what the options out there. And I think that if you're at all interested in any area, and it doesn't have to be healthcare related, just to do some research, ask to job shadow. That's what I did. After knowing I was going to do some sort of healthcare, I job shadowed in a radiology department. And that is where I found there was all these different areas that you can work in under the radiology umbrella. And then I did some research, and I really enjoyed the lab and the math behind the diagnostic of nuclear medicine, because there is more to just laying a patient on the table and getting pictures. There's more to that. So that would be the advice, just to do your research. And if you feel like it's not something that you would like to do every day, then it's probably not the area that there's something else out there for you.
All right. Well, thank you for your time today, Ms. Lickteig.
Yeah, it was my pleasure. Thank you.
Thank you.